Okay, good afternoon, good evening, wherever you sit. This is Major General Jeff Milhorn, and coming to you live from Brooklyn, New York, here at Fort Hamilton. And forgive me as I kind of get reoriented as to where the cameras are, because I would like to be able to look into your eyes and just again exchange my sincere thank you over the last few weeks as we all continue to endure the ongoing COVID-19 pandemic, as well as get after the defeat of it based on all of your actions. This afternoon, I wanted to kick off this live session in my attempt to, again, open up lines of communication with the workforce across all of the North Atlantic Division and extend my heartfelt thank yous, as well as provide updates across the entirety of our area of operations within the North Atlantic Division. I've tried to do so by sending emails usually every 2 weeks, just to keep all of you informed of what we were doing, and more importantly, giving you updates of our execution, but most importantly, to acknowledge that your health and welfare have been utmost important to me and to our command as we move through the current conditions that we're all operating in. Before I really begin, though, today, I wanted to take an opportunity to acknowledge one of our own who we lost just yesterday. And if I might, I did call the family today and let them know that I was going to recognize personally Mr. Ralph Debarry, who served with the New York District as an architect for over 15 years. And as you can proudly see in this photo that I'm displaying, also served 5.5 years with the United States Marine Corps. This is a picture with his wife, Lydia, and their daughter in the celebration of her wedding, Jacqueline. And who is not pictured is their daughter, Christine, and their very proud grandchildren of Ralph and of Lydia, who are not represented, but again, who think so kindly and lovingly of their grandfather, who is now gone. We lost Ralph after a battle in the hospital of nearly 3 weeks, attributed to a variety of complications, but certainly also the COVID-19 pandemic virus. What we do want to recognize and honorably acknowledge is his service to our nation, the service to the United States Marine Corps, the service to the United States Army, and our own U.S. Army Corps of Engineers. And as I spoke with Lydia earlier today, to acknowledge the entire family and to keep them all in our thoughts and prayers, as we think so fondly of what Ralph has done for all of us, and that he will certainly never be forgotten. It is an opportunity for me also with all of you to recognize the family and others that have been influenced and impacted by the pandemic. And I recognize that we have extended family members that have also been lost throughout our profession, throughout the North Atlantic Division family. But again, if you wouldn't mind with me, join me in a brief moment of silence as we recognize the Debarry family and offer them again our prayers. Thank you again. Well, ladies and gentlemen, it is with exceptional honor and pride that I get to talk to all of you today and share with you what we've experienced over the last few weeks, given the current pandemic, as well as all the other actions that the Corps have performed admirably, never stopping. We're not starting back or going back to something that we haven't stopped doing. We've just transitioned based on the conditions that we have ongoing about us. And it's of absolute pride that I share with all of you today, the concept that we saw birth nearly 6 weeks ago in mid-March. As I think many of you are aware of our transition to action on behalf of the Department of Defense in support of the Federal Emergency Management Agency, when we saw the pandemic beginning to spread not only from Asia and across from Europe, but into the United States, and truly here in the epicenter of New York, as we've continued to watch even it expand beyond and outside of the North Atlantic Division region, westward across the United States. It's a global pandemic. And though we've done everything we can to share even amongst ourselves to be rapid in our response, we've shared it across the United States and our territories. We've also shared it with all of our international partners, our allies, and other host nations. And I'll talk a little bit about that. Today, I'm joined with several of our experts as well. And my intent is to give you just a quick update in terms of what we've done, what we're continuing to do in support of the fight against the pandemic, and certainly to also provide recognition to a team of teams that have contributed to our success. But we're not done. And we recognize that, again, that we haven't turned off everything else that we're doing. In fact, we've just modified the approach in which we're doing it. And I'll share some of those things too. And then we'll open this up to questions and answers that I recognize all of you have, even as we anticipate a future transition. Again, not turning back on because you never turned off. So if I will, please allow me to kind of describe our successes and then recognize a few people also that I want to acknowledge today personally based on all of their endeavors. And there are quite too many for me to acknowledge based on the workforce that we've seen displayed. Those that were often doing the work from the comforts of their home through the telework agreements that we have in place, but also those that put themselves in harm's way each and every day out on the job sites, in the Javits centers and other locations as we continue to retrofit the facilities that were so important to all of the communities that we live in, to all of our families that could be benefactors of all of our efforts. So if I will, as we saw this start to occur in mid-March timeframe, and we saw the concept of employment, of using coming up with designs for alternate care facilities, or ACFs that we've come to term, that could be employed, whether they be in compartmentalized locations such as dormitories or hotels. We called it a hotel to healthcare concept. And then we also looked at convention centers or arenas or field houses, which we called an arena to healthcare concept. We've looked across the industry to respond. How could we respond very quickly? You can't build something new. You can't build a hospital out of the ground in a short period of time. And so as you've witnessed, even Lieutenant General Todd Simonite, the Chief of Engineers, acknowledge on multiple media opportunities, just describing how this very simplistic concept could be decentralized and executed by all of our districts nationwide in a very quick time period. Really holding contractors and others to periods of performance, to timelines that they'd never seen before, based on the absolute need of a response in a very quick period of time, whether it be 2 weeks or 3 weeks on the ground, watching the peaks and the modeling efforts by so many other organizations so that we could beat the peak, if you will, and do everything we could to provide capacity to hospitals that were already strained and continue to be stressed, to include all of those heroes and healthcare workers that all of you have seen, witnessed, recognized even here in New York. I think 7 o'clock every Friday, you'll hear pans being banged together and trumpets being tooted from outside of the windows of the apartment complexes across the region to acknowledge the heroism and the heroic actions by so many healthcare workers. And in that, I also acknowledge all the first responders and our Corps of Engineer employees that are right there out there with them, putting these things and putting these facilities into operation or building them out. The interesting thing was the concept was meant to be also taken by the states individually in the District of Columbia, across the nation, if you will, and employed as necessarily. They didn't necessarily have to use all of our efforts, but through our contracting efforts, we were able to deliver much faster sometimes based on all the tools and instruments that we have available to us based on the unique contracting authorities that we preserve. I wanted to go back and recognize just a few people based on literally over 1,100 assessments nationwide. 25% or over 25% were conducted here in the North Atlantic Division. I think at last count, 241 assessments across the 12 states and the District of Columbia, supporting the Federal Emergency Management Agency's regions 1, 2, and 3. Fascinating to me, again, was our ability to respond by putting planning teams in with the state EOCs almost immediately because of where we sit and where we live today. We were already geographically distributed, and that's why we were so quickly able to respond with our FEMA counterparts, our health and human service professionals under the National Response Framework that exists during times of emergencies. Things that we've already suffered through within this region, like Hurricane Sandy 7 years ago and 9/11, even longer. And now we add to it a pandemic. That wasn't a regional response, it was a nationwide, a global response. And so now we have something else, a new playbook to pull off of our shelves in times of need, one that is still being refined today. I do, as I said, want to recognize several people that allowed us to enable us to build so quickly the capacity that was so much needed across this region. To Jill Stiglich and her contracting team at headquarters USACE, the entire vertical chain, to Dave Cooper and all of our attorneys and Office of Counsel, Laura Eichhorn, the senior contracting official from Atlanta, to include Tristan Brown, her attorney, to the NAD contracting team, Scott Helmer, Jason Moy, Rip Roberts, Captain Catherine Fargas, and assistance even rendered by Lieutenant Colonel Ems, who came back briefly. To New York, Frank Cashman, contracting chief, and his deputy, Nick Emanuel. To Matt Emmenholtz, chief of military PPE&D, but during this time frame designated as the alternate care facility acquisition project manager. From Philadelphia, Greg Keaton, contracting officer, and contracting specialist Jamal Edwards. Tom Guybeson, PM forward there, operating across New Jersey as we speak today. And also to Baltimore, where again, the bulk of the work between those three states of New York, New Jersey, and really in Maryland and the District of Columbia at this time. Paula Beck, contracting chief, Patty Morrow, contracting officer, Paula focusing as a contracting officer for the DC Convention Center, which is right now being built, as well as in Hagerstown and the United Medical Center by Patty Morrow, Mike Getz, who happened to help across all three as a contracting specialist, and Dara Van Loo, who served as a PM forward. Those individuals that I just listed have specifically been engaged across literally the 11 or 12 contracting actions that we have in place today that are either in the process of having been turned over or will be turning over in the coming days. And we will be done with all of those efforts before the 10th of May, which is phenomenally impressive by the entire team. And I recognize, though I only name those few, there are hundreds of others through reach back and back to their home areas where, again, through our maximum telework policy that we have in effect, all are leveraging and contributing across the board. All have been advised by our resource management teams led by John Primavera, as well as our own counsel with Ms. Maureen here at the table. I've got safety also represented here today, represented by Greg DiPuppo, as well as everybody recognizes, Ms. Dawn Clappsy from Human Resources. All of our experts here, and we'll address again here soon enough all of your questions that you may have, and those that I've taken down and noted that are of concern to all of you as we again look toward a future transition that will occur. And it may not look like what we started with in the February and March timeframe. There may be a new normal that we define based on the actions that we've all demonstrated over the last few weeks. And we'll take that into consideration as guided by our higher headquarters, not only at headquarters USACE, but the Office of Personnel Management, OPM, and certainly the Department of Defense. We'll also guide our actions, first and foremost, protecting the health and welfare of our workforce and our families. That is, again, will remain prominent in everything that we do. But they will be guided not only by those other organizations that I mentioned, but also by state and host nation restrictions that are also imposed upon our workforce at this time, as well as all of our family members that, again, we continue to take care of through this time. And we will recognize that, and we will take all of that into consideration, and we will exercise the most extreme precautions as we, again, begin to transition back to a new normal that is yet to have been defined. And so though I expect that there are plenty of questions out there of, General, what might you be doing differently than what we did before? I will tell you that all of us are still in the mission analysis phase as we look at the alternatives, to include looking at how we reduce our footprints. How do we maintain social distance? How do we look to the professional and the personal protective equipment that should be distributed where needed across the workforce to ensure that you're protected? while also taking into considerations those restrictions and constraints that are also placed upon the workforce, to include face coverings that the Department of Defense has announced, to include what the states have also required of all of us, no matter where we live and work today. And so we will look at all of that, and we have begun to look at that. When the Regional Management Board was hosted by Mr. Rhino Koenig, who hosted all of our DPMs most recently, in fact, last week, and they continue to reconvene as we look to how do we maintain the agility and flexibility of our workforce as we look toward the transition that we know will be coming. It is coming, and that's good news. But we're also going to be very responsible in protecting the health and welfare of our workforce, as I said from the very beginning. And I will ask those hard questions, as many of you have already asked me. And though I may not have the answers today, there are things that we can address. And I brought the experts in the room with me today as those questions are provided to each and every one of us. That was really, as our focus continues on the pandemic, certainly. And we still have work to be done there. We are starting to see, as I said, transitions occurring here in New York and New Jersey. And most of the work and advice and assessments that we provided to the other states across our region have been owned by the states themselves, working with all of their state agencies and all the federal partners that I mentioned, from FEMA and the Health and Human Services and others, as a whole of government approach to this response. But what I did not acknowledge yet was all the other work that you continue to be doing all along across our civil works portfolio, our military programs, our international and interagency and environmental services, our regulatory and operations and maintenance. Incredible. Literally, of all the portfolio and all that we're doing, less than 8% of the projects have truly been impacted. And that's a tribute to all of your efforts, no matter where you sit, as I mentioned before. And is that something to take light of? Absolutely. We have to understand, hey, these dynamics that we're operating in, and the teleworking and the alternative work locations that we're operating from at this point in time, we have to keep that in mind. And what does that new normal look like? We are measuring all of that, and we are discussing that openly amongst ourselves. I share that with you because I think there are opportunities here to be innovative and creative, as you have been over the last few weeks. And then how do we leverage that moving forward and take all that into consideration into our business processes and our business practices? So again, I may not have all the answers today, but we are starting to drill down on those questions that many of you have already asked and that we are asking of ourselves in terms of how are things going to change and how do we ensure the protection of our workforce when we transition, not turn back on again, but just transition to a new normal. Over the last day, I've had an opportunity to travel, actually over this last week, and it started with being picked up on a landing zone not too far from here at Building 302 at Fort Hamilton. Compliments of the Superintendent, Lieutenant General Darrell Williams at West Point, who has lent me the use of his aircraft to visit many of the sites, whether that be across New Jersey, certainly across here in New York, and most recently into Washington, D.C. I had an opportunity to go out and engage with our PMs forward and all the workers that have put themselves in harm's way, if you will, under the current conditions, working with the contract teams. What has been most notable to me in most every situation that I've been in, there has not been one loss to the pandemic in terms of lost work hours or safety at any of the sites that I've recently visited. A true testament to everybody, to include our contracting community, our PMs forward, our employees wearing their red and their white, their hard hats and their shirts, all across each of those project sites. Not one of them have been lost to the pandemic. And that's because we have taken those measures seriously. The social distancing and the provision of the personal protective equipment across those locations. And as I asked each of those locations, at 2 yesterday in Westbury and Stony Brook alone, building out sites of over 1,000 bed spaces, they have not lost any of their workforce either. A true testament to everybody giving way together and taking care of one another. No bickering amongst ourselves, just getting after it 24/7, 24 hours a day, 7 days a week if you will, at all of these locations to enable this capacity that, whether we need it or not, it may be an insurance policy that we've invested in because we don't know what might happen in the future. We don't know if there's going to be a second peak or even the plateau that some of us have experienced, and even the downturn of the current stage of the pandemic. Will we see it go into a dormant period and maybe rise again in the summer or in the fall or into the winter of 2020? We don't know yet. And though we continue to consult with experts, they themselves are continuing to analyze the pandemic and what might occur. We've invested in the capacity. The chief of engineers talks about a three-legged stool. You have to have sites. You have to have supplies. You have to have staff. And our effort in that is taking out the sites, working with the states to identify the locations and to go in and retrofit those locations appropriately. We took that variable right out of the equation from the very beginning. And those of you that are mathematicians or engineers know that if you reduce the number of variables early on, it's much easier to solve the problem. And we do that each and every day. We solve our nation's toughest challenges, and now we've added a pandemic to our playbook. And I'm confident, based on what I've seen and witnessed on the ground, or walking through the Javits Center in downtown New York with an N95 mask on in a COVID environment, watching the patients being taken care of by health professionals and all of our engineer workforce that have contributed to this. I could not be so more immensely proud of this organization, of all of you, of all of your families, and all that you've endured in this time of crisis. And guess what? We've risen to the occasion yet again, and we will in the future. I am absolutely confident of that because I have to be. I have my utmost confidence in all of you and the professionalism with which you operate, no matter where you operate from. Geography does not matter. There are not enough adjectives for me to describe how proud I am of what each and every one of you do each and every day on behalf of the United States Army Corps of Engineers. And with that, I am going to transition to question and answer period because I want to hear from you, for those of you that have been asking. And I have Ms. Jennifer Gunn, our Public Affairs Officer, that is monitoring the live chat. And Jennifer, I would ask if you can to scroll through and ask some of those questions. And then if those that are not, and if they're not redundant to the ones that I already have, that I've also received through email, through Facebook, through LinkedIn, and multiple other media events, please do not hesitate to ask.
We do have a first question. It says, are you planning to provide hazardous duty pay to all essential employees?
So I will turn to Ms. Don Clappsy here, but before I do, again, that is not anything that Jeff Milhorn can define. That will have to come down through additional guidance from the Department of Defense and the Office of Personnel Management across the entirety of the U.S. government. So I cannot say that I will make that offer, but if those changes or policies that are being scripted and defined by the federal government are identified for those employees that applies to, then absolutely we will pursue and ensure that those who are entitled those identified items, then we certainly will look to ensure that they receive those benefits. But let me turn to Ms. Don Clappsy.
Sure. Good afternoon. Hazardous duty pay is something that's already authorized by the Office of Personnel Management. Commanders can provide some benefits under hazardous duty pay, but the issue right now is there is no DOD or Department of the Army guidance on how to apply hazardous duty pay. Basically, at this juncture, if that guidance is provided, we certainly will share it at that point. If a commander believes that somebody is in a situation where hazardous duty pay should be authorized, then that would be something he can consider. Over.
Okay, thank you, Don.
From your district, how does the president's three-phase Opening Up America Again plan apply to the NAD organization?
So the federal plan that will guide how states define how they're to meet certain gates. I think that all of you have witnessed what has been published and even announced by the President of the United States and have been followed up by all the health professionals as we look to the forward application. I have got to certainly, again, as I mentioned early on, we have restrictions and constraints that are imposed not only by the federal government, by each of the individual states, but because this came from the Europe district, there are also other foreign nations that are applying restrictions and constraints to how the workforce might be able to even return to a transition back to the workplace. And so we have to take all that into account. And that's why I've charged the R&B to review through their own mission analysis and to provide the maximum flexibility to each of the districts who are uniquely different based on state constraints, host nation constraints, and certainly Department of Defense and federal constraints that have been imposed. But again, we'll look to that. I cannot anticipate writing one policy that will bring everybody back or transition back on the same timeline, just based on the unique circumstances that we all face. I do not know that, ma'am, if I saw my attorney, I don't know if she had raised her hand or not. Was there, okay, no additional comments there, so.
Next question, this goes to the pay cap. Are there still limits in place to the amount of comp time and overtime you can claim during this crisis?
So I'm going to turn that to Mr. John Primavera.
So in the CARE Act, the supplemental that essentially is paying for a lot of the COVID-related benefits, there is the ability for agency heads to elevate the annual pay cap to about 197,000. The agency heads are considering doing that. I believe they will, but they have not pulled that trigger yet. We're still waiting for direction from the chief. But we expect some relief with the pay cap.
Okay.
We have a follow-up to the hazardous duty pay question. To Ms. Dawn Clappsy, are you saying there is a way that a commander can pay employees now before any guidance from OPM comes out?
Yeah, what headquarters USACE HR is saying is the Department of Defense and the Department of the Army has not released any guidance in this area. However, there is OPM guidance that is always on the books and in the Code of Federal Regulation that allows commanders to issue hazardous duty pay if it is warranted. Hazardous duty pay would only be issued to those employees who are actually performing the type of work that would put them in some type of harm way, and it would be done by a case-by-case basis. The concern here is within USACE is there is no DA guidance, there is no DOD guidance, and it's really very difficult on how to apply this consistently across the Army Corps of Engineers at this time. But the bottom line is the commander can authorize it at the district level if they believe that there's a situation that warrants it over.
Okay, the next question is about travel. With all the travel restrictions, how likely is an exception to policy for TDY or PCS to be approved? And can you explain that approval process?
So I'll talk a little bit about that, and I'll certainly defer to any of the experts in the room as well. But what we do is we review. There are certain travel requirements that are tied to mission essential tasks, which again, we have those that are that we defined early on to include not only our response to the COVID-19 pandemic, but also critical operations of various facilities and mission essential job sites that we want to ensure that the construction and our project oversight of that continue. Others that have been constrained by the Department of Defense stop move orders, and possibly again, whether they be state or host nation constraints that might also impact our workforce. We look at those on a case-by-case basis, and we review certainly the implications of the mission criticality of that individual, as well as the hardships that may have been incurred by the individuals. And so we look at those individually each and every day. But there is no current policy in effect that does not prohibit us or prevent us from granting the exceptions to policy where we see that need being made. And I don't know if Ms. Clappsy or if Mr. Primavera have anything you'd like to add.
No, sir, nothing else to add.
Just that there's a formal process, goes through the G3 up to headquarters for approval for anything TDY related within CODIS, any PCS moves with Sec Army. And there's also additional, one thing we learned during this crisis, there's one of the things we need to do to protect our people. We got to change to the JTR to allow PDS, local TDY within the permanent duty station rather than people going home and affecting their families. So there is that ability. But again, commander has to approve it, has to go up to the chief. But we've been getting all of that approved. Anything associated with a FEMA mission assignment task order has been approved. Anything associated with a critical construction project has been approved. But they are, going to look at each one on a case-by-case basis.
A question from the chat. Have weather and safety leave been provided to employees that are affected?
Okay, John, go ahead, please.
The quick answer is yes. That we have authorized weather and safety leave. What we've been stressing for the good of the morale of the organization, because we have a lot of work, we want people to be engaged. We've been stressing exhaust all available work, whether it's direct project work, whether it's overhead funded work. We want people to work. We want people to be engaged in the organization. We need the contributions of the entire workforce, but where that's not feasible, whether people are not allowed access to a site because of COVID-19 related issues, whether there are other public, shutdowns of project sites or local government, restrictions on movement, we have authorized weather and safety leave. The problem with weather and safety leave is it's not free. It comes out of the leave account. The same account that pays for your leave and benefits pays for this weather and safety leave. So we need to try and control it as much as possible. And we've been doing a great job in our districts through the telework program of doing so. Because at some point, if it gets out of hand and we have to raise our rates, it affects the amount of people we can afford to hire. It affects our affordability. Stakeholders may walk away if we cost too much money. So we still need to keep that under control. But yes, weather and safety leave has been authorized and will continue to be authorized as required. District commander's call cannot be delegated below the district commander. But yes, we have used weather and safety leave.
Advanced question from New England. Once our offices reopen, will allowances be made for employees with health concerns to remain on telework?
Okay, so again, this is where we're going to be very cautious as we transition back. And we will look certainly at those populations that are most at risk. I would anticipate that they may be slower to return based on the conditions. And then again, we'll continue to assess to include the hygienic practices within the facilities themselves. And I know there was a question here earlier about, will all facilities be cleaned prior to occupation? Well, most of the facilities have not been completely unoccupied. In fact, we've had folks coming in and going out based on the availability and the tools that they may have required to operate or continue to work in support of our ongoing efforts. We are making necessary sanitation checks on each of those facilities. Certainly, if we've had individuals quarantined based on symptoms that they've, whether they were positive or negative, we've taken the necessary precautions where necessary, and we'll sanitize those sites. So I don't know, Don, if there's anything else you'd like to add to that.
No, sir, I think the phase approach is appropriate. I think we need to look by case as to what makes sense at each of the different locations. And I think we will take the prudent advice to make sure we take care of our people so everybody's comfortable and feeling safe when they return back to the workplace.
Advanced question from New York. Going forward, will the Corps maintain a supply of PPE within its offices to ensure the safety of all employees should the need arise in future?
Okay.
I'll take a crack at it. So I think the answer is yes. We have purchased masks when necessary for field personnel. Maureen McAndrew just gave us an opinion that will allow us to buy face coverings for our workforce. So again, it's commander's call, but most likely we'll be purchasing face coverings. Again, a lot of the PPE is dedicated to people in the field that are working construction and operations project sites. There's less of a need for that within district headquarters, but we'll continue to provide sanitizers and wipes, making sure that officers are cleaned more frequently, deep cleanings if necessary, if there's unfortunately someone falls ill. We'll do whatever we have to do to make sure people feel safe coming to work, bottom line.
And if I might add to that, because I know there was a subsequent question related to that in terms of are we to provide PPE or the personal protective equipment beyond the workforce, beyond the workplace, to include mass transit, transportation and things along those lines. Again, if you look at the state constraints that are required of each of the individuals, whether you're in a grocery store or some of these others, some of that will fall to yourselves because you have to comply with even those requirements when you're out and about shopping. And so I would expect that similarly, those face coverings, not necessarily the masks themselves. And when we talk about the masks, we're not talking about N95 masks. We're talking about face shields or coverings that would be most appropriate, again, to provide you with the confidence that that you're being protected. But we're not going to take away from those who need those more critical items for the healthcare workers, for example. But it still is incumbent upon each of us as we travel about, whether you're on duty status or off duty, to comply with those various state constraints. And some of those may be wearing your own personal protective face coverings, as would be required in accordance with the laws of each of the states that you live and operate in, or within those host nations for those that are overseas.
Question from Norfolk. What, if any, accommodations are being made for those who may find themselves in a use or lose leave status because of the travel restrictions associated with coronavirus?
Go ahead, Don.
Sure. Okay, the use or lose policy will still remain to be active. We may eventually get additional guidance for those individuals who may have been working on a COVID-related project, who may have a mission essential requirement to carry over their use or lose leave. So I do believe we will see more information come out on use or lose, and I do expect there will be categories of people who may have not in the past been covered by the use or lose leave requirement. Will be probably get it this year.
Will employees be required to undergo temperature checks and answer medical questions prior to coming back to work?
Go ahead, Greg.
So as is right now, the temperature taking protocols at entry are not a mandatory procedure. I think that local commands need to make decisions as to whether or not it applies to them. One of the biggest things is, okay, is your locale heavily hit with the COVID-19 virus? And then B, what is the actual worker density there? Density obviously impacts the ability to socially distance, and then obviously that compromises the ability to safely, prevent transmission from occurring. So in short, the answer is no, it's not required. Yes, some sites may require it. Here at Fort Hamilton, it's mandatory when you come in the gate. Other military installations, it may be a similar phenomenon as well. But in a nutshell, it's going to be a local decision as to whether or not your local district offices decide to implement some sort of procedure like that, or if your local project offices or your operation sites. Other things that need to be considered, obviously, is how many people are actually working at that site, and then feasibility plays into everything.
So if I can add to that too, and we recognize that those are additional efforts that in our ability to protect the workforce and some of the screening. Can we make that mandatory for everybody? No, I don't believe we can. And I've got Ms. Maureen here to check me from an Office of Counsel perspective. We also recognize that any employees that are using that capacity are now having to charge to that. And so that has not been set up at this time. But what has been mentioned is, again, depending on where you sit, we sit on a military installation here. Based on the health force protection measures that are currently in place, we put in a screening to even return to Fort Hamilton, where everybody has to answer a series of questions related to the pandemic, and then also have their temperature taken with a remote gun, if you will, that takes your individual temperatures. If you crest over 100.4, if you live here, you're immediately escorted and quarantined to your quarters. If you work or don't live on the installation, you're immediately turned around, and your chain of command is then notified of those conditions. We have seen across the force at multiple sites, to include the alternative care facilities that we've retrofitted. I'll use the Javits Center, where you similarly you cannot even enter the facility without a mask on, and again, very quickly you have to answer a series of questions, and your temperature has to be screened before you're allowed to be admitted into the facility. Why? Because you're protecting all of the healthcare providers and those that are trying to take care of the patients that are operating those facilities 24 hours a day. So again, we will take that into consideration. We may receive additional guidance, not only from headquarters USACE, possibly from Office of Personnel Management, and certainly the Department of Defense as we look to what might be prescribed and defined. However, just as we anticipate that our health force protection condition will lower from Charlie here at Fort Hamilton, it'll go back to Bravo and eventually return to Alpha, which are the least restrictive. We would anticipate those health measures to also be reduced over time as we see the disappearance and hopeful overarching end to the COVID-19 virus.
From the chat, the last guidance about our recreation areas states that they are closed indefinitely. Is there any guidance on if this will change in the near future, or should we be going by what the state determines?
So to that end, and as the Chief of Engineers made mention, even most recently in a series of question and answer periods in front of the media, as well as his guidance to review our procedures in opening up the recreation areas for those that may have been closed. We recognize the implications of the social distancing and the protection of our rangers that actually maintain those sites. And we will probably look to a flexible opening. Some of that will be tied back to the states, certainly, and the constraints that they have imposed to include any restrictions that are imposed statewide. But where we can open earlier, we will look to do so. But again, ensuring that the health and protection of our workforce is utmost number one. We recognize that up from the very beginning, so we'll make sure that they're well taken care of, and certainly to the health and welfare of those who would leverage or take advantage of those facilities. We want people to get back outdoors. We want them to experience and enjoy the facilities that we are all so proud of. And so what we will do is again look at maintaining the flexibility. It will not be one cascading policy. It will not be one associated timeline. It will be based on the conditions that each of those locations face.
Also from the chat, what is the protocol going forward to inform our workforce if they have potentially been exposed to COVID-19 by a USACE NAD coworker?
So I highlight that this is not just an NAD coworker, it's enterprise. It's not just the United States Army Corps of Engineers. It's those whom you come in contact with every day. And so again, the conditions, without having the testing as pervasive as you're seeing being asked for, not only from the national government, the states themselves and what they're trying to enact, but as folks become exposed to those who are known to be COVID positive, and or symptomatic, we will take the necessary precautions. There's a balance here also, though. I have to acknowledge that certainly we will follow the CDC instructions and comply with that. And I can have Greg review what some of those quarantine periods are that we require and the sanitation requirements as well. But again, without having the positive confirmation of some of the tests, we will do the best we can with a short period of time to enable you to also work within those spaces after a sanitation period occurs, to include bringing in a team to do more deliberate cleaning of the spaces. It is incumbent upon the supervisors also to keep the chain of command informed of their employees, of those that may be identified as having some type of symptoms. And again, whether you're sick with a COVID-19 virus or you're not feeling well, you still have a responsibility to keep your chain of command informed, because we want to make sure that your health is best being taken care of, and that we, again, quarantine you through self-quarantine or self-isolation procedures, principally back at home. I am concerned, though, that those who that don't announce or share with us that they're not feeling well, you need to stay home. You need to protect yourself, and you need to protect the rest of the workforce that you might interact with on any given measure. We are still in a maximum telework stage at this point in time, and we demonstrated through all of your actions that it is working fairly effectively. We had some challenges with IT from the very beginning, but quite honestly, to ace it and to our G6 communications and information officer, the teamwork across the board. They have expanded the capacities substantially, both on the East Coast and in the West Coast. And I'll leave it at that. Greg, anything else that you'd like to add to that?
Yeah, real quick, I wanted to just kind of piggyback on what the general was saying with respect to supervisory responsibilities as it relates to employees coming and going from the workplace. As is right now, many people are teleworking, and if an individual needs to show up to the office, just quick pop in, print things out, you say hello to a couple individuals, and then they go back into telework status. If it's not communicated widely, supervisors are unaware that they were in fact at whatever installation that they may or may not have been. And then if they subsequently get sick, that information needs to be tracked. That's the whole concept of the tracing. In order to effectively determine who may or may not have been exposed, we need to know where that individual went. So supervisors, it is enormously important that you are keeping tabs on whether or not your workers are showing up and interacting with other individuals. With respect to how we deal with COVID positive cases in the workplace, there's basically two options. The first one is really, you convey the information to any individuals. They'll go into a 14-day quarantine if it's a presumptive. And then there's two options for the disinfection of the actual facility. The first option, and this has been advocated by headquarters USACE Commander Janisco, but it's ultimately leave the space. Leave it for 7 days. The virus is no longer viable thereafter, and then people can safely return. And then if that is not a viable option, the alternative would be to get a cleaning crew in there, do deep sanitation in accordance with CDC recommended procedures.
Okay, thank you.
Question from New England. How should districts address the continued 6-foot social distancing mandate in buildings where workspaces and corridors are not able to accommodate upon a return to work?
So I would take, not only is that applicable to New England, it's applicable to every district within the U.S. Army Corps of Engineers. It's applicable to the public, the private, the nonprofit organizations that all are going to have to go back and review social distancing procedures as we, again, transition to a new normal. And that may require looking at how have we set up our spaces? How have we protected ourselves? And again, we don't have any additional guidance right now from the Center for Disease Control or Health and Human Services that may further contribute to, well, do the walls, the partitions that we maintain between ourselves serve to counteract that, or do we need to make changes? And so we will review what options are under consideration, guided by largely our health professionals and the sanitation requirements. Again, I open the floor up to any of my professionals in the room for anything that I may have not addressed. Okay, let me go to the Office of Counsel. Maureen.
Yes, sir. Well, just to add that that's one of the reasons why I opined recently that the agency could use appropriated funds to purchase cloth masks. It's to comply with the CDC guidance, where if people are not able to maintain the social distance of 6 feet, that they can put a cloth covering over themselves so that asymptomatic people do not infect their coworkers. So that's to benefit the workforce and not the person individually. So just FYI, that's, another possible solution, sir.
Okay. And what you can't see in this room today, even at these tables, are measured pieces of tape that have been placed across the conference room tables more than 6 feet apart, to include even my public affairs officer over my shoulder. I said, why do I have a piece of blue tape here in front of me? And she goes, well, that's what I had to measure my 6 foot distance. So we continue to manage it even here locally. But again, we will do what we need to do to ensure, going back to the personal protective equipment, that all of you feel confident that your chain of command is absolutely in your corner and looking out for your best interests. Next question, please.
After the COVID-19 pandemic is diminished, will there be continued leadership support to the telework policy?
So I will say that, again, these are all the things that we're looking at to determine what does a new normal look like, to include telework policies, alternative work schedules, alternative work locations, sites that we may not have considered before as we increased our social distancing across not only the North Atlantic Division, but across the enterprise as a whole. Where, I've been asking questions even of each of the districts as to where we may have had challenges in the past, to include maybe even security challenges in certain cities. Do we look at alternative work sites? and consider moving functions or respective offices to other locations to the benefit of the employees in our workforce. And absolutely, we will go back and review the telework policy, the alternative work schedules, and alternative work locations. But I'd also defer to Ms. Dawn Clappsy, because I recognize that human resources in coordination with the Office of Personnel Management is also looking into that as well.
Right. Within the region, General Milhorn has delegated the telework down to the district commanders. So each district commander has the ability to shape their telework program that fits their needs locally. And I think with the use of telework, we have proven that maybe each policy at the district level maybe should be reviewed in light of the success that we've had in the past. General Milhorn, you've been a wonderful supporter of telework and also alternate work schedules as well. And I think our organization has proved we were successful with that. But again, it has to be managed locally. It needs to make sense. And maybe not every position is suitable for full-time telework, but there is certainly that flexibility that commanders can use if it fits their organization.
Okay, and I know even, and I'll ask Mr. John Primavera to talk to this a little bit as well, because we'll take the financial aspect of that into account as well. And we're working with GSA and other agencies that really manage the real estate that we, for the most part, lease from those spaces. And do we in the future, like other organizations, and I'm talking across, again, public, private, and nonprofit organizations that are going to go back and review each of their individual business models to determine, is there a reduction in overhead? Do we reduce space, or do we increase space based on social distancing requirements? So we'll take all that into account. But what you won't do is see a very specific policy that is applied to the entire region, because again, each of your circumstances are unique. And if I can power that down and delegate some of that authority to each of the districts because of the uniqueness of their circumstances, that's what I intend to do. So, Mr. Primavera, anything you'd like to add?
Sir, just that, we're looking at this hard. I'm on the RMV, so we've been tasked by the CG to take a hard look at everything that we're doing, both short-term and long-term, to be more effective in a remote environment. We're making investments in IT. We've already had incredible results from the new CIO's G6 with the increase in VPN. We're talking about buying additional equipment for folks to telework more efficiently at home, to try and replicate as closely as possible their workspace, if their space can afford it. Not sure if everyone's husband or wife's going to want 2 monitors on the kitchen table, but if you're fortunate enough to have the space, to have a little office carved out, maybe we can outfit it so that you can work from home more effectively. General Milhorn is absolutely correct. There's a way we can reduce our rent, which is the highest in USACE as an RBC. That's something we have to consider. We can get rid of a floor in New York District and save $3 million. That's something that would benefit the employees. A little bit better work-life balance, the ability to work from home. B, we save a few bucks in our overhead and make it more cost-effective. So yes, we're looking at everything. Some things will be short-term, next 3 to 6 months. Some things will probably take a little bit longer, but yes, we absolutely are looking at everything.
Okay, and just again, allowing me to add is, as we review certainly bargaining unit agreements and those employees that are not represented by units, again, or unions, will also take a look at this holistically to again ensure that the rights of each of the individuals are protected across the entirety of the workforce. From that standpoint, I do want to be consistent, because I do not want to create a double standard in terms of the haves and the have-nots, if you will, across our workforce. That's important to me. I hold all leaders accountable to that. And my expectation is that we treat everybody with the greatest dignity and respect that we can, regardless of where you sit. So again, or whom you're represented by. So thank you for that question. What else?
If you are over the age of 65, will you be restricted from returning to work once the office is reopened?
So whether you were 60, which was the previous question, or 65 or over, again, we are going to look at a population that could be at risk and be slower and very cautious about everybody returning or transitioning back. And so, of course, right now, I'm not ready or prepared to state that this is the cutoff, because quite honestly, there are people that are younger than 65 or 60 or 50 that are predisposed towards other conditions that could have them at significant risk as well. And we've seen those families been impacted over the course of the pandemic, even today. So I just, again, we'll consider all as we, again, look toward a future transition.
And so, of course, we'll look at the Center of Disease Control guidelines as to what we should be looking at as far as how we're phasing people in, because that certainly is important.
Okay. Yes, ma'am.
Yeah, and I'll just add too, sir, that, the latest OPM and OMB guidance encourages supervisors to maximize telework flexibilities for vulnerable populations, to include those 65 and over and other categories of in the CDC.
Thank you.
Some more from the chat. Pre-symptomatic and asymptomatic carriers may not be ID'd during temperature scans and medical questionnaires. How will USACE plan to address exposure to and spread from this population in the phased return plan?
Okay, I've got Mr. DiPuppo. Go ahead, Greg.
All right, so valid question, and this question is ultimately the nexus of why the CDC modified their guidance with respect to face covers. So I just want to summarize very quickly what the safe face covering guidance is. Basically, anybody who is not able to maintain social distancing at any core facilities needs to be wearing a mask. And that is basically the reason why we're wearing a mask. Obviously, is many of our population are not demonstrating symptoms, and that is why it appeared to be increasing the spread of it. And so, in a nutshell, basically, if you're not showing symptoms, the mask's purpose is to protect others from you and not vice versa.
Okay.
Another question from the chat. If an employee comes into contact with someone at work and becomes COVID-19 positive, will they have to use their own sick leave, or will they be able to use work comp or admin leave?
Okay. Obviously, anybody who is sick should request sick leave. If you believe that you have a workers' compensation claim, you certainly can submit a workers' compensation claim form, and it'll be up to the Department of Labor to adjudicate that particular case.
And this will be our last question. What is the outlook from NAD on when we will be back to normal operations?
Okay, so as the pandemic continues and we continue to monitor the various curves, the models that all of you have witnessed that were either described by the Center for Disease Control, by Health and Human Services, by the Federal Emergency Management Agency, we continue to monitor those state by state and across the U.S. territories, and certainly watching the implications for those of our employees that are deployed overseas, nation by nation as well. And so it is difficult for me to put a timeline on when everybody will transition back. We are starting to see increase of activity based on where we are in time and space on some of the other portfolios of work we have, most of which have been able to be done over a teleconference or via telework. And so right now, I don't see this immediate requirement for everybody to, if you will, transition into the workplace. But again, each of those timelines will be analyzed by each of the districts respectively based on the conditions and those constraints that are imposed by states and other foreign nations. But the RMB, the Regional Management Board, again, led by Mr. Kona, co-led actually by Mr. Kona again and Ms. Karen Baker, along with our DPMs and the representatives from across the corporate boards structure, are reviewing all of those facts. And as they change within each of your districts and each of the regions that each of you live and work, we'll see proposals of those transitions and those timelines, again, taking into consideration other constraints that we are not controlling, be they federal, state, or other host nations. So more to follow on that. We're watching it every day. So I think that was the last question. Let me, was there anything that anybody within the room here had that they would openly share? Greg.
I apologize. I feel like I didn't adequately answer the last question. So obviously the face masks are a fantastic prevention mechanism for transmission. I just want to reiterate, wash your hands, socially distance, wash your hands, socially distance. Make sure that you are cleaning your surfaces. Make sure your cleaning crews have robust, enhanced cleaning schedules for high-touch surfaces. None of this stuff is rocket science in terms of prevention mechanisms, but it requires an enormous amount of internal discipline to execute on a consistent basis. What it really boils down to is just make sure you're washing your hands and you are keeping your distance from folks, and that is your best chance for preventing transmissions.
Okay, so we're approaching the end of the hour, and I am cognizant of everybody's time and the efforts that all of you continue to execute on behalf of all of us, whether it be, again, in support of the ongoing pandemic, or certainly across the myriad of our large and complex portfolio, again, whether it be here in the continental United States or Europe and abroad. I cannot say again how proud I am to lead this organization, to serve with and for each of all of you and your families. And we will do everything we can to continue to exercise caution on our future during our future transitions. There will be no one single timeline for everyone. We will take that into account and tailor it to the dynamic environment that we're all operating in today. And as those transitions occur, both north and south of Brooklyn, New York, where we sit today. But I cannot say thank you enough for what you've done and what you continue to do each and every day, and how proud I am to serve with all of you. We know there are a lot of questions, and we'll continue to respond to those. And I will continue to provide updates, as will each of the district commanders, either in their own town hall forums or in their letter writing campaigns to all of you, to keep you informed and update you of the ongoing activities and actions. I cannot impress upon how important it is, though, for each of you to stay in contact with each of your supervisors, especially during times of need, especially if you feel ill and you need assistance, or you have questions and concerns about returning or transitioning back to the workplace. Let us know. Stay informed. Ask the questions, and we will be as transparent as we possibly can, knowing very well that some of these policy changes that have to occur at echelons even above our headquarters here in Brooklyn, New York, those that are going to have to be worked out between the federal government, from the Office of Personnel Management, the Department of Defense, as they apply to all of us, and then certainly taking into account and tailoring our transitions based on the dynamic environment that each of us are operating in, no matter where you sit and live. So again, let me close by saying thank you very much for all that you do. Your health and welfare is absolutely, I cannot reemphasize how absolutely important it is to me personally, and that I hold the chain of command accountable to that as well. And then lastly, let me close once again as we remember the Debarry family, and that I ask that again, you all keep them and other families that have been impacted by this horrible virus uppermost in your thoughts and prayers. Thank you so much for what you do. God bless you and your families. God bless America and the United States Army Corps of Engineers. Thank you very much.